Hi, I'm Jodie Walsh, partner here at Cutcher & Neal, with an important snapshot of what this federal budget really means for health-focused individuals and practices. This budget is sending a very clear message. Healthcare, care services, and long-term system sustainability are firmly back on the national agenda. At a high level, this budget leans heavily into strengthening Medicare, expanding aged and disability care, and investing earlier in preventative health. There are also important updates for practice owners and investors because your structure now plays a bigger role in your outcome than it ever has before. But as always, the real question is, what does this mean for you and how should you be responding? For individuals, the immediate focus is affordability and access. There are a couple of straightforward positives for employees and sole traders, including a new $1,000 instant tax deduction and a $250 working Australians tax offset that comes into play from 2027. We are also seeing meaningful investment being made in bulk billing, urgent care clinics, and expanded access into medicines and vaccines. There's a strong emphasis on early intervention, from developmental support for children to dental care for adults, through to expanded screening and mental health funding. In simple terms, the system is trying to intervene earlier to reduce long-term costs and improve outcomes, and that's all putting us in a really positive direction. But from a financial perspective, this reinforces an important truth. The public system works best when they're complemented by good personal planning. Structures matter more now than ever, whether that's how your assets are held, how superannuation is used, or how long-term health and wealth planning are integrated. This budget creates both opportunity and responsibility. There is increased funding flowing through into our hospitals, into Medicare services, aged care infrastructure, and home care. Other positive measures for practices will include things such as the $20,000 instant asset write-off being made permanent and the 2-year loss carryback rules being in place to support cash flow. At the same time, we are seeing much greater scrutiny, particularly around things like Medicare integrity, digital systems, provider compliance, and fraud prevention. And that's a clear signal. Practices that are well-structured, compliant, financially disciplined will be those who are best positioned to benefit. Those practices that rely on legacy structures or set-and-forget strategies may feel more pressure as the reforms continue. Across the budget more broadly, we are seeing tightening around tax structures, investment settings, trusts, capital gains, and property incentives. From the 1st of July 2027, the traditional 50% capital gains tax discount is being replaced with an inflation-adjusted model and a minimum 30% tax on real gains. For investors and practice owners, this reinforces that structures are no longer static. What might have worked well 5 or 10 years ago may not deliver the same outcomes for you going forward. There are also big changes on the way for trusts, with the introduction of a 30% minimum tax on discretionary trusts from the 1st of July 2028. Trusts aren't being scrapped, but the way they are used is clearly changing. For many who've relied on income splitting, this is a moment to pause and reassess. Is your trust still the right vehicle? And if so, what are these cash flow implications going to be? The main takeaway from this budget is those who review early, align their practice and personal strategies, and plan through change are going to be far better positioned to protect their wealth and stay flexible. Please get in touch with an advisor to understand how these changes affect you and how to move forward with clarity and confidence.